Welcome to the Vitamin Professor podcast, brought to you by VRM Media, publisher of Vitamin Retailer and Nutrition Industry Executive Magazine, in partnership with Nutraland USA. I'm your host, Gene Bruno, Professor Emeritus of Nutraceutical Science and Chief Scientific Officer of Nutraland USA. The purpose of this podcast is to help educate the dietary supplement industry about the science of nutraceuticals and other relevant topics. If you like what you hear and see, don't forget to like and subscribe. So, I'd like to tell you a little bit about our guest today. Meagan Garza, pharmacist, PharmD, a licensed pharmacist and educator. She's passionate about personalized, holistic, patient-centered care. With advanced training in community-based pharmacy, practice, and academia, she engages pharmacy students and professionals nationwide through teaching and professional development. Her interests span integrative medicine and One Health initiatives, with a particular focus on how homeopathy and other complementary modalities fit within the self-care market as safe, accessible, and sustainable options. She's currently pursuing a Master of Public Health with a concentration in public health leadership to design and lead initiatives that drive health improvements across generations. Welcome, Meagan, to the Vitamin Professor.
Thank you so much. It's a pleasure to be here with you, Dr. Bruno.
Well, listen, let me ask you, I have a number of questions, but, let's start out with this one. What is homeopathy and how does it differ from herbal medicine or supplements?
Yeah, absolutely. So, and that kind of pinpoints one big misconception that dietary supplements and herbal medicines are the exact same thing as homeopathy. People use them synonymously, but that's not how it should be. And so homeopathy is its own system of medicine. It's got a history of over 200 years, but really what it's doing, it's giving the body a stimulus, that being a starting substance that is either a plant, an animal, or a mineral, and it is giving the body a stimulus to go ahead and start regulating the own body's ability to heal itself. And so it's really unique in that sense. But at the same time, this misconception I often address with the regulatory status, in that homeopathic medicines are drugs, whereas your herbal medicines, your dietary supplements, are regulated as food. And so that regulatory space there is often a quick way to identify or differentiate between the different systems there.
Thank you for that. I've seen this again and again. I've seen people thinking that they know what they're saying refer to like the use of supplements sometimes as homeopathics when of course it is not.
No.
So thanks for that explanation. Now, further to that idea, how are homeopathic medicines prepared, and how does that process differ from how vitamins or herbal supplements are made?
Yeah, absolutely. So with that, herbal supplements, of course, you're using that herbal substance with all of its active constituents that it does have to help, regulate normal bodily functions or help improve bodily functions. When it comes to homeopathy, the way that they're prepared is through a course of serial dilution. It's a very unique process that is standardized. And one of the things, in addition to it being regulated as a drug, there is a homeopathic pharmacopoeia of the United States that outlines all of the quality standards that go into sourcing and manufacturing. And so starting with those substances and ensuring their quality, it'll go through a process of dilution. Dependent on whether or not those substances are soluble, it can go through a trituration, or it can go through a process where the chemical constituents are pulled out through a water and alcohol mixture. And ultimately, we're getting at a mother tincture, so a solution that contains all of those active components of that starting substance. And then homeopathy continues on with a dilution series. And so it's really important that we're keeping in mind that has been researched and all of the standards are backed by, different testing with the manufacturing processes. That dilution process, it's really important to keep in mind that there must be a vigorous shaking in between each of those dilutions in order for them to maintain their activity. And so with that being said, all of that is calibrated and, like I said, very well outlined in all of those standards. And so that is how homeopathy in itself is regulated and manufactured. Once that final solution or dilution is received from that homeopathic starting substance, then at that point they use an innovative method called triple impregnation, and they will use that to then coat things like sugar pellets or lactose tablets, different types of dosage forms with that homeopathic dilution.
Very good. Now, I have a friend of mine that is also a PharmD and trained also in homeopathy. And so, I've talked a lot about it with him over the years. And I'm going to ask you the same question I asked him. So as a pharmacist, what initially drew you to homeopathy, and why do you think it's relevant for today's wellness landscape?
That's a great question. And this is something that I love to bring light to. Because as you may know, as previously teaching at a pharmacy school, it is not often incorporated, and if it is, sometimes it's very minuscule in the curriculum. And so as a pharmacist, what initially drew me was experience working at an acupuncture clinic in pharmacy school. I chose to go that route instead of just working in the pharmacy space. I really wanted to broaden my own knowledge and kind of open my eyes to all the different types of modalities that were out there. So when I started working at this clinic during school, I had no exposure to different types of Eastern medicine. But homeopathy was one of the modalities that this clinic had. And so every patient had the same story coming in. They were failed by the Western system in some way, and they were looking for something different. And homeopathy was just one of the tools in the toolkit, which is what we like to say. But patients were, their autonomy was respected. They were presented with their different options. And as a pharmacist, for me, I wanted to continue with that ability to respect patients' autonomy, be able to educate them about the different options that were out there, so that they can make informed decisions for their own health. And so for me, that was a way that I was able to complement my traditional PharmD education with a lot of the complementary and alternative side of medicines that are out there as well.
Very good. Much the same as my friend and his motivations. Now, one of the other things I had conversations with my friend about was the mechanism of action, because when we think about drugs, there's a pharmacological mechanism of action, and even if you're talking about dietary supplements, there's still a pharmacological mechanism of action. But homeopathy is something a little bit different. You mentioned, like traditional medicine, like Chinese medicine or that sort of thing, and in that we look at things like qi and movement and energetics, and so I'd like you to explain a little bit about what is, though we don't know absolutely for certain, what is thought to be the mechanism of action for homeopathy.
Yeah, so we can definitely address that. And I will say that I think in the pharmacy community especially, that is the one question that people are like, all right, but what's the mechanism?
Yeah.
But when you think about it, we've been using drugs and all sorts of things for years without fully understanding mechanisms.
That's true. Even aspirin, when it first came out,
Exactly.
They didn't really know why it worked. They just know that it worked, and it didn't stop anybody from using it.
Right.
Now we know its mechanism, but that happens all the time. You're correct.
Absolutely. And so this is just another example we have yet to fully discover. But the fact of the matter is that a lot of people, of course, associate homeopathy with just, it's implausible. That's what they're saying. There's no way this is true. It's simply placebo. But, I mean, with that being said, can you please repeat the question? Sorry.
Yeah, sure. Basically, what I'm really getting to is, what is the proposed mechanism of action? What do we think is the mechanism of action?
Okay. Yeah, so this is definitely the big question, and we do not have a solid answer here. With that being said, of course, there are numerous examples in history of us using pharmacologic agents without fully understanding a mechanism for many, many years. And so, with that being said, we're just in that time period where we haven't nailed it down. But there are different theories that are out there. One of them is a nanoparticle theory. And this one, Iris Bell is one of the scientists that published this works. But essentially, you're using the concept of hormesis and a time-dependent sensitization. And all of that, those nanoparticles or nanostructures are then leading to mediating the stress response in our bodies and ultimately leading to healing, whether that be locally or globally. And so nanoparticles as a theory is one of them. Nanopharmacology has been widely studied, and so that is just one avenue that homeopaths are also going down as well. The other is coherence domains. Essentially, this results in electromagnetic frequencies that are altering molecular structures that lead to biologic activity. It's important to pinpoint at this point that each homeopathic medicine has its own signature. With that being said, it has its own pathway to biologic activity that unique medicine will target. And so, because we don't have a mechanism of action blanket statement for homeopathy, it makes it really difficult. But there are research teams all over the world that are looking at particular homeopathic dilutions of certain starting substances, and they are finding biologic activity. But just because they are doesn't mean that goes to show that all of the other homeopathic medicines must follow that exact same pathway. And so that makes it very challenging. But you're right, it goes against a lot of our scientific dogma, what we think about on the conventional side of things. And so that's why a lot of people will just dismiss it and think that it's so implausible, that all of this anecdotal news that we hear about it, that it is so effective, they just disregard simply as placebo.
You know, it's interesting because when many years ago, when I was first exposed to homeopathy, to me it also sounded sort of odd and implausible, but at the same time I was open-minded about it. And there's nothing quite as powerful as personal experience.
100%.
I had a couple of experiences. One was I had some pretty nasty, I lived in California at the time, and I had some pretty nasty allergies, airborne allergies. And I would get the most incredible itchy eyes. I could not get the itchy eyes to stop. It was absolute misery. We tried different things, different medications, eye drops, what have you. And my previous friend that I mentioned, recommended a homeopathic remedy. And I was absolutely and utterly shocked. I didn't expect it to work, or if it worked, I didn't expect it to work quickly. But I put this homeopathic remedy on my tongue, or under my tongue, and I can tell you that in less than a minute, I got relief. And I was like, oh my God. And then I thought, maybe it's a placebo effect. And I thought, but that doesn't make sense because I didn't think it was going to work.
Right.
And it did. And then I used that subsequently many times. And another example for me was same friend who happens to have a wine cellar in his home. And one night I was visiting him, and he took out multiple bottles of wine, and without going into too much detail, I was young and stupid and drank way too much. And I was doing terribly the next morning. He comes to the guest room, he goes, okay, you ready to go on that hike that we had planned? And I'm like, oh my God, I can't even move. If I move, I'm just going to get sick. It's terrible. He goes, I know just what you need. You need some Nux Vomico.
Yep.
And he came, he gave it to me, and I'm like, fine, it's not going to work like that. It's not going to work quickly. Within 20 minutes, I was out of bed and and we were walking out the front door to go to the hiking trail. And it was the most powerful examples for me. Now, I am an N of 1, so that doesn't make a study, but it does show powerfully that, to me it did, that this stuff really works. And I'd recommended different homeopathic remedies for people over the years who had some pretty good results. So I just wanted to share that with you. One of them is something that I want to talk to you about as well, but I'm going to ask you a different question first. So you talked a little bit about trying to explain this to colleagues. What are some of the most common misconceptions about homeopathy, and how do you respond when those concerns are raised by patients or colleagues?
Yeah, that's a good question. And I will say, because it's not well taught, even in pharmacy school, I will talk to pharmacists and they'll be like, "Oh, I love that supplement. That supplement." And I'm like, "Okay, let's have a conversation here." And it always goes back to just the fact that there's a healthy level of skepticism that must be had. And at the same time, you need to be open-minded. Because, like you said, having that personal experience is powerful. And that can come from a colleague, that can come from a friend or a family member, and people talk. Especially nowadays when, on the conventional side of things, it's one medication after the other just to tackle all the different side effects that occur.
Indeed.
So people are getting frustrated and they want other options. And so, especially with colleagues, I know homeopathy is available everywhere. Every natural grocery store, on Amazon nowadays, every pharmacy. And the fact that even then, the pharmacists still, in the United States, the average American pharmacist cannot have a competent conversation on these drugs, these homeopathic medicines, always blows my mind. And so that is one of the main reasons why, as a pharmacist, I now love to educate both pharmacy students and professionals and simply just have that conversation about the fact that no, these are not the same thing as a dietary supplement. And no, it's not placebo. And I go into it, of course, further, and I talk about its use with animals and with plants and how we're not convincing the crops that it's working for them, yet it is. And it's reducing like pesticide use, it's reducing the overconsumption of medications in humans, things like antibiotics and NSAIDs that, lead to further challenges. And so when you put it in that perspective, when we're tackling big things like antimicrobial resistance, polypharmacy, and the overuse of medications, that opens their eyes and they're like, whoa, well, I mean, if you're using it for things like that, well, then maybe I should consider. But I always remind them of the fact that they are considered the drug experts as pharmacists, and these are drugs, and so it's your professional responsibility no matter what. And that goes a long way. It's something, like I said, that's not readily accessible everywhere, and everybody learns differently. Everybody cares about different things, and so I oftentimes try to make it very individualized, depending on who I'm speaking to, what they care about, what they've heard, and kind of creating that safe space for them to bring in all of the curiosities and the doubts, and talk about it in that sense.
Very good. And you said something important. It is a drug. Homeopathics, my understanding of it from a regulatory standpoint is it was sort of grandfathered into the Food, Drug, and Cosmetic Act way back when, and it is essentially an over-the-counter medication. And so, albeit ones that have a considerably better safety profile than a lot of conventional pharmaceuticals, but it is, and it can be very, very effective. And I for one believe that pharmacists should be required to have training in homeopathy, just so they can understand how to advise their patients. I feel the same way about dietary supplements. They should have training in that. And too often that doesn't happen. So, I want to ask you about, I have a question for you, but before you answer it, I have a quick story. My question is, are there any studies demonstrating that homeopathy is effective? And then I want to tell you that I once, years ago, I was out doing some training seminars and for a chain of vitamin stores. And I had a case of the flu, and I was just absolutely miserable. And one of the ladies who owned a store said, "Oh, I have just this thing for you. It's called Oscillococcinum, and I want you to try this." And man, again, I was struck with just how powerful an effect it had on me in reducing symptoms and helping me to feel so much better. So let's go back and answering the question, are there any studies demonstrating that homeopathy is effective? And obviously I kind of led you down a path there because I know there's something on Oscillococcinum.
Yeah, absolutely. So that's probably one of the most researched products for sure, homeopathic medicines that's on the shelves. And I will say it's probably the most recognizable too. That's the one that patients will literally walk in knowing exactly what they want and they take it straight to the counter. just because it's that popular. But it is research backed. There are 2 studies, and I feel like they're a bit outdated, but there are others that have come about. But the ones that have been published in the 1980s essentially showed that over 60% of participants had either complete resolution or significant improvement within 48 hours of flu-like symptoms.
Yeah.
And so when we think about the indirect costs associated with illness, people don't want to miss days of work. People can't miss days of work. And so incorporating something like this that is readily available, and like you said, that personal experience, they maybe have a friend that recommended it to them, or I would hope a pharmacist that says, hey, this is an option. I don't know if you're familiar with Tamiflu, but it's not my favorite drug as a pharmacist, and that window of opportunity is very small. And so the Oscillococcinum does come in a family pack, and you're able to use it in your kids up to your grandparents. And so
Yeah.
that's the beauty of homeopathy, that it can be used in all of these different populations. But there certainly are clinical studies to back that particular product. And over time, like I mentioned, it's been studied all over the world. Recently, I looked into some more, and people are looking at the cost effectiveness, or kind of like that real world data behind using homeopathy versus conventional medicine. And I believe it was an Italian research group that used it in their health system, and they saw that it decreased the frequency of upper respiratory tract infections and had cost savings associated with that. So they were able to show some cost effectiveness, and that's just one example. But there are certainly others. But to this day, I still hear pharmacists saying, like, "Oh, it's just placebo. Don't waste your money on that."
Yeah, I see a lot of the same kind of things. I see that with homeopathics, and I also see a lot of them making the same statements even about dietary supplements. And it's frustrating to people like you and I who have looked very deeply into the mechanisms of action, the research behind it, clinical efficacy, and a lot of these people, because they didn't have the training, they tend to poo-poo something that doesn't fit into their paradigm, as opposed to keeping an open mind and saying, okay, what's the other paradigm? Look at traditional Chinese medicine. If you're a Western practitioner, you don't know traditional Chinese medicine. You may not know acupuncture. You may not know any of those things. You may not be familiar with the qi and that whole paradigm. But it doesn't mean it doesn't work. And when you look at that, and you look at something that's been around like that for thousands of years, or homeopathy that's been around for a very long time, you see some incredible results that people are getting. Back many years ago, when I was doing the training for this chain of vitamin stores, the chain actually took on a number of BOIRON products, and I got to see firsthand how customers would come in, use them, and come back and talk about the great results they had. So that was very, very nice to see, and also helps to understand, helps improve the understanding that these things really do work for the common people. Now, speaking of retail, what role do you think homeopathic products play in a retail environment, especially for customers who are already using conventional or natural therapies?
Yeah, like I mentioned earlier, I think it's just another tool in the toolkit, and we need to acknowledge it as such. I think oftentimes it's literally on the shelves, but it'll get passed up simply because the person helping either the customer or the patient doesn't feel comfortable enough to have that conversation. And I mean, you think about the rapport that can be broken with a patient that comes in, maybe just recently learned about a friend that has had great success with homeopathy, comes up to their healthcare professional, and immediately the healthcare professional is like, oh, put that away. We don't believe in that, quickly dismissing their interest in trying something new. That breaks trust, and that's a problem. And so that's why I mentioned one of the big things as a pharmacist is wanting to be able to help patients make informed decisions. And so weighing the risks, the benefits of all of the different options out there, and respecting their autonomy and their choice. And I think same goes for all of the different retailers of these homeopathic medicines. Education is key, and that starts with educating the team and being able to help other people make the best decisions for them with all of the options that do exist on the shelves, because there are many, and it can be overwhelming for a lot of people who are coming in and trying to figure out the things that may be accessible to them. I'm sure you're aware that online people hear all sorts of things, misinformation from all sorts of different avenues. And so they want somebody that they can trust. That this kind of goes to show, there was a international survey that was done just in the past year, and what they found was that in most other countries, people that are interested in using homeopathy do it for one, natural reasons, but also they're more likely to go to a healthcare professional or ask for help to buy and to use. But in America, we're the only exception in that people are more likely to go to Dr. Google or go look online or go buy online. And so a lot of the time the reality is that people are using these medicines without one even knowing that it's a homeopathic medicine. And if they do, they might not be mentioning it to their doctor or their pharmacist because it's not being explicitly asked, because it's not part of our education.
Exactly. And by buying it yourself, if you don't know what you're looking for, part of the problem is you don't know if it's even the right remedy. You can have according to homeopathic protocol, if you have a set of symptoms and somebody else has some of those same set of symptoms, it may not even be exactly the same remedy, or even if it is, some of them might not be readily apparent to somebody. Like roost tox, for example, that's like basically a homeopathic preparation of poison ivy, which doesn't hurt anybody, but actually has really good results and can actually help, let's say, joint health. But people wouldn't go, oh, I should get a homeopathic preparation of poison ivy to help.
Right.
And so they don't know. So they really should. So that makes a case for not just talk to people who know about it, but that kind of also leads to my next question. How can natural product retailers better educate their staff and customers to understand and more confidently recommend homeopathic medicines?
Yeah, and I think this goes with just education being the key to everything. And so it is an investment in your people to educate your staff at these retailers on and have those competent conversations with patients. And it takes time. You can't just simply give this information to these people who are helping customers. You need to be able to give them that lived experience, and that's where that personal component comes to play. I always tell pharmacists, understand the user perspective. You have stress, you have sleep issues, you've got, first aid ailment, things like that. Start incorporating homeopathy into your own regimen. Use it for your own family, and then at that point, you're building that comfort to be able to then have those conversations, share your lived experience with others. And it certainly goes a long way. Like you mentioned, that's very powerful. And so same goes to show when you are doing that for those natural retailers and you're empowering them with education, but not only that, with some of that lived experience, then they're able to go on and help other customers or patients.
So related, I was just wondering, does BOIRON offer any kind of documents or anything that can be used by retailers to help educate their staff?
Yeah, 100%. So that is one of the things I love about the company. Not only does it have a solid history for many, many years, but it truly values that education piece, especially from a standpoint of we're not trying to sell our products. We just want you to be able to learn homeopathy. And that is what I do as a pharmacist. When I'm educating students, when I'm educating pharmacists, I'm solely there to talk to them about generic homeopathic medicines. I want them to be able to learn, and BOIRON as a manufacturer, they have wonderful resources on their website, but other manufacturers do as well. And then there are other more general associations. The Homeopathic Research Institute is great if you want to learn more about the research side of homeopathy. There's a National Center for Homeopathy, and that's great, like more consumer focused
Sure.
information. So there are resources out there, but I think the company does a wonderful job of that balance. So yes, there's the sales side of the company, but there also is the side that is solely there to educate on homeopathy, and it goes a long way. And I mean, the opportunities that I've had to, have a controversial conversation. Homeopathy is controversial, and I'm bringing it up in groups of pharmacists who've been in the industry for 20 plus years, but those are the ones that sometimes they're set in their ways, and sometimes they tell me, like pharmacognosy was something we'd learn about all the time back in the day, and nowadays you don't hear about that stuff.
You're
And
right.
so it's mixed, but for the most part, people are curious. They do have a healthy level of skepticism. You just have to put the resources kind of in front of them, make them more readily available, because oftentimes someone's not just going to go out of their way
Yeah.
to learn on their own.
And if you're a retailer and you're listening to this, ask your representative for those materials, because I can tell you years ago when I worked with this retail chain, I actually got materials from BOIRON, and I actually integrated it into the training program. So it was there, and the people got trained on it, and consequently they were able to sell it better. By the way, the reason I pronounce it BOIRON is because my first initial training on this years ago was from some people from France who said, "You pronounce it BOIRON." Okay, BOIRON.
Yes,
So
yeah.
I've done that since then, but whatever. Okay, so one
I
more
will
question.
say too, if I could
Yeah.
add, when it comes to the education, I give them total credit because they are innovating the game when it comes to gamifying and just making it so easily digestible for your everyday adult learner.
Yes.
And that has gone a long way. And so definitely exciting resources out there that are not just simply handouts or long recordings to sit through.
Exactly. So here's sort of my final question. I think, can you give examples of sort of, let's say, common health concerns where homeopathic products are especially helpful or well suited?
Yeah, so I mentioned a few already. We talked about oscillococcinum, so that one for flu-like symptoms. In the space of the common cold, that's another. But things like stress, sleep, for women especially, and that's where some of my lived experience comes from when it comes to PMS control, menstrual cramps,
Yeah.
even further along into menopausal relief. There are products for that, and these are all available over the counter. Um, Great place for people to start, I think, is always in the first aid space. So things like calendula, arnica,
Yeah.
those are very popular. And typically, if a pharmacy is carrying anything at all, it's those two and plus a silo. Other pharmacies, as they get more familiar, then their inventory starts growing, and so there are more options out there. But BOIRON, as a manufacturer, they do a great job of making sure that, especially as healthcare professionals, we have access to samples so that we can have that lived experience and share it with others. But those are just a couple examples. You mentioned Nux vomica, definitely great for overindulgence, whether that be caffeine, alcohol, food, all sorts of things like that. And so definitely lots of different conditions that homeopathy can be applied to, for sure.
Cool. Well, let me ask you just, is there anything else that we didn't cover that you'd like to say to help our listeners understand a little bit more about homeopathy or specifically BOIRON products?
Yeah, I guess one thing we didn't really talk about was some of those basic principles. We talked about the
Yes.
dilution component of the infinitesimal doses, and so essentially the higher you go on the dilution scale, the more potent. But the very first principle that Samuel Hahnemann founded homeopathy on was like cures like.
Yeah.
And that concept goes way past Hahnemann, and so it starts with Hippocrates, really. And so way back then, that concept of like cures like. And I always like to give the example of onion or Allium cepa. And so that itchy, watery drainage from the eyes and nose that you get from chopping up onions, that is the same exact substance that we're using in a homeopathic dilution to treat that symptom picture. And so I always like to give that example of like cures like, and of course there are so many other starting substances from whole honeybees to all sorts of different types of plants that we're using with that same principle in mind. And I will say a lot of the most promising research out there is really targeted on that individualized approach, where we're not looking at the patient as their condition, but we're looking at them as a whole.
Right.
And so I have a cold, you have a cold, we wouldn't necessarily get the same homeopathic medicine because it could look differently for the both of us. And so when research is designed to recognize the individuality of all of these different patients, and they're going through the full homeopathic method through the lens of individualization, at that point then they're seeing the most positive outcomes. But you can imagine when it comes to designing research like that, it's quite extensive and costly if you're taking an individualized approach for each participant in a study. And so
it makes it very difficult. So that, when I learned my homeopathic basics back when, we said if you have a homeopathic practitioner, they can take you through the process and target a remedy. But if you don't, then what you look for is a good homeopathic brand like BOIRON, who has some combination formulas where they're using some common remedies that hopefully at least one of those remedies are going to hit and sort of do the job for the person who's using it. And so, if you have a homeopathic practitioner, fantastic. But chances are you're going to have to buy some of these things on your own. So looking at those combinations are a good way to do it. And if you have somebody in the retail environment who has a little training, they can be helpful as well.
Absolutely. And I mean, that's another differentiation. These products do have indications on them. They relieve certain symptoms as opposed to the structure function claims that are made on dietary supplements. Arnica montana, for example, in the discoloration or bruising, muscle stiffness, they're very specific things that these medicines will target, and each one has its own indication on there, which differentiates homeopathy in that sense. So you're completely right in the fact that a lot of these combination products do help the everyday person that's coming and wanting to try homeopathy make that informed decision based on those label inclusions.
Very good. Well, listen, I want to thank my guest today, Dr. Meagan Garza, for sharing with us her wisdom about homeopathy and telling us a little bit about BOIRON brand of homeopathic remedies. And also, I want to tell our listeners that, again, if you liked what you heard and you liked what you saw, please don't forget to like and subscribe. And we'll see you next time on The Vitamin Professor.